Hello, and welcome to SleepMore Medical, the consumer's advocate in sleep medicine. SleepMore Medical is the most advanced company in the sleep industry because we improve every step in the process of being diagnosed and treated for sleep disorders. We do that not only for patients, but for physicians, specialists, insurance companies, and Medicare. Let me tell you about a few of the ways that SleepMore advances the current process. First, only 1 in 100 primary care doctors are sleep certified, and SleepMore defends them because let's face it, they don't have the time to learn about one, much less all 84 of the different sleep disorders. What's SleepMore's solution? We provide in-office respiratory therapists and sleep therapists to primary care doctors. These trained technicians answer questions concerning the process and, more importantly, the exact cost for each and every patient. SleepMore then guarantees that if a patient follows SleepMore's guidelines and the patient's bill exceeds SleepMore's projection, SleepMore will pay the difference, guaranteed. Now, primary care physicians believe they are sending their patients to the appropriate sleep lab, when in reality, they simply don't know. SleepMore is the first and only company to survey patients throughout the entire process, and then we deliver that information back to the primary care doctor. So because we're able to provide that information, they and you can be assured that you're being directed to the highest level of quality of treatment available. Now, your next challenge is, when should you use a board-certified sleep doctor? I mean, they cost more because they're specialists, right? Well, the answer is, it depends. SleepMore believes that every patient should be fully informed so that they can make the proper decision for themselves. We do that for the public through our toll-free information hotline at 855-KC-SLEEP. We also do it full-time for our affiliated doctors. Now, the next interested party that you require information on is the sleep lab. Did you know that there are 4 different types of sleep labs? There are independent sleep labs where you don't even need to be a doctor to own one. Then there are independent sleep labs that are accredited by the American Academy of Sleep Medicine, which does require a board-certified sleep doctor on staff and overseeing operations no matter who the owners are. The third type of sleep lab is the hospital-owned sleep lab. Did you know that many hospital-owned sleep labs are not accredited sleep labs? And guess what? SleepMore tells you who they are. The fourth type of sleep lab is the hospital-owned accredited sleep lab, and of course, we'll share that information with you as well. Now, on top of the 4 well-known types of sleep labs, there are independent companies that do home sleep testing. SleepMore Medical recommends a home sleep test when applicable. For that information, call toll-free 855-KC-SLEEP. The next piece of the puzzle is the therapy provider. In the sleep industry, we call these DMEs, or distributors of medical equipment, or HMEs, which are home medical equipment companies. So beware, there is only one that is certified by the American Academy of Sleep Medicine, and of course, that happens to be the only one we support here at SleepMore Medical. Finally, we arrive at the dentist. For years, the dentist has been viewed as a competitor to the sleep lab. What the dentist does is provide you with an oral appliance that gently holds the jaw forward. In approximately 1/3 of all cases, the oral appliance is a viable solution to sleep apnea. However, many sleep apnea patients also suffer from one or more of the other 83 sleep disorders, and these can still lead to diabetes, erectile dysfunction, heart disease, hypertension, and many other ailments, the worst of which is death. That's right, death. Did you know that if you have sleep apnea and you take a sleeping pill, you can sleep right through while you suffocate? Sleeping pills are the worst thing you can take if you have sleep apnea. Now, before recent changes in Medicare findings, the challenge with the dentist's office was that the oral appliance was never paid for by insurance. Now that Medicare has approved this therapy, insurance companies will usually follow. Before, it was considered dental and rarely paid for by dental insurance. The well-informed medical insurance companies support paying for an oral appliance when ordered by a board-certified sleep physician. SleepMore believes in providing patients with choices and allowing them the freedom to select their best options for treatment. SleepMore Medical makes it our mission to achieve better outcomes at the lowest possible costs, not only for the patient, but for all parties involved. Every patient wants and deserves not only more information, but the best information. SleepMore Medical empowers the patient and leads them to better overall health care. We achieve results throughout their sleep disorder treatment. Everything that a patient desires to know about sleep disorders is on our website or a quick and free phone call away at 855-KC-SLEEP.